Welcome to Module 5 on recording and monitoring COVID-19 vaccination. My name is Jan Grevendonk. I work at WHO in the Immunization and Vaccines Department. This module will explain the importance of proper recording and reporting. It will help you use registration forms and recording forms. It will help you correctly record vaccination data and register vaccinations in those forms, and explain how to track defaulters. Proper recording and reporting of vaccinations is important. First of all, it's important for the individual who is vaccinated because they need a vaccination card or a certificate or a proof of vaccination. For public health, it's also important to monitor progress with vaccine uptake and coverage, to help with vaccine and supply management, and finally also to inform vaccine effectiveness and vaccine safety through the COVID-19 surveillance and safety AFI surveillance. There are several kinds of records that need to be kept to document vaccinations. The first kind are the home-based records, so the vaccination cards or certificates that are kept by the individual or the person who is vaccinated, and that they will need to prove vaccination, for example, in the case of travel or employment or education. The second kind of records are kept at the facility, and they include vaccination registers, so books in which the names of the vaccinated people are kept, but also electronic tools like electronic immunization registries if that's in use in your country, or medical record systems in the practitioner's office. And for countries that use aggregation-based reporting, so there are tally sheets that are used to help keep track of the number of people who are vaccinated, and then the periodic reports, often monthly, but it could also be weekly, to actually report the number of vaccinations provided to public health authorities. Let's focus on these home-based records first. So vaccination cards or home-based records serve first of all as a proof of vaccination that individuals can use for travel, educational or occupational purposes. So that is for the person themselves. But they're also very important for public health purposes. They are needed, for example, to establish the vaccination status of the individual during households or coverage surveys. They're needed to get access to the vaccination information in case a positive COVID case is detected or an adverse event following immunization. In those cases, it is very important that the investigator can retrieve information about the vaccine used, the lot and the batch number used, and the facility that provided the vaccination. These records will also provide immunization records to people who don't traditionally received one, for example, all older adults. And that record can then also be used to document other vaccines, like, for example, influenza. And finally, in case more than one dose will be required, as will often be the case, the home-based records can be used to monitor the timing of subsequent vaccination. So it will help you, or it will help the individual to know when to go back to the health facility. Countries may choose slightly different templates for home-based vaccination records, so it's important to refer to the instructions and standard operating procedures on how to use and fill out the national or even subnational standard for that home-based record. But in general, we know that the home-based record need to include at least personal and contact information of the person who received the vaccine. And then there will be one line for each dose and booster. And those lines will need to contain at least the date of vaccination, which product is actually used, so what is the actual vaccine and the manufacturer, which dose number was given, was it the first, second, third booster dose, etc., which batch and lot number was used, what the name of the facility was, or the provider or the institution that actually vaccinated this vaccination, and finally a stamp or signature of the provider. And then ideally also the home-based record has some place for a date for a next dose that the individual will need to complete the schedule. Apart from home-based records, there will also be facility-based records. So they are kept at a health facility or hospitals or long-term care facilities or even the private practitioner's office. And they serve the same purposes as a home-based record. They actually include a lot of the same information, but they can also help the providers to send reminders to patients, for example, to find people who received the first dose but haven't come back yet on time for their second or third doses. And finally, also to help you find data about a vaccine recipient of yours and report that back to public health authorities if needed. For example, in case of an adverse event following immunization, you can find the batch number that you used for that patient and report it back as needed. Data that is included in the facility-based register or the facility-based record is quite similar to the information available in the personal vaccination record. So it includes information about the vaccination, the vaccine, the lot number, etc. But there's some additional information that is needed. For example, contact information of the vaccinated person, any important risk factors for the person. For example, do they have an allergy? Were any adverse events registered after previous vaccinations, or are they specifically at risk for COVID-19 disease? If you're required to send a periodic report to public health authorities, there's 2 additional tools that you will need. The first tool is a tally sheet. So here, for illustrative purposes, we included just a sample template, but basically your country will have a national policy and a standard tally sheet that you will have to study and find out what kind of information needs to be captured and in what kinds of different target populations you will need to separate the vaccinations that are provided during a session, during a day, during a week, or even a month. So the tally sheet, first of all, it helps you to keep track of vaccinations by target population. And while your country tally sheet might differ, it's kind of foreseeable that at least the age group, the sex of the person, and whether or not they have any pre-existing conditions will be dimensions according to which you have to distinguish the vaccinations. So what you need to do is find out for everybody who you vaccinate, whether a person is, for example, at risk because of an existing condition, is over or under 60 or some other number that your country decides, whether this was a first, second, or booster dose. And then you find the right box in which to tally the vaccination and you fill that out as you go immediately after the vaccination. At the end of the period or the session or the week or the month, you can then transcribe all this information about the vaccinations into a periodic summary report that have the same fields and that you can use to summarize all the activity of the health facility or the vaccine provider during a certain period, and you send that to the public health authority, for example, to a district. And then for periodic reporting, according to the national guidelines, you should be able to report every week or every month before certain deadlines how many vaccinations were administered. You should refer again to the template that is in use in your country and the standard operating procedures that go with them to explain how to fill in a report. But at least reports will include vaccinations administered to the target groups, so the different target groups that are prioritized by your country. Also vaccine balances, probably information about the vaccines that were used, vaccine spoils and wastage, any adverse events following immunizations that were detected after immunization, and any other information that is required by your national or subnational reporting standards. COVID-19 vaccines will require several doses, so depending on the product that is used in your country, it might be 2 or 3 doses, and maybe also booster doses after that. So at some point it will become important to find in your facility-based registers or electronic systems that information and find which individuals were immunized the first time but didn't come back for immunization for the second dose or the third dose. So in those cases, you can try to contact those people by using SMS, phone calls, or community volunteers, and try to follow up with them and make sure that they come back and are fully protected by the vaccine. Other resources that will be useful for you should be produced by national authorities. So they include guidance, reporting forms, standard templates, standard operating procedures that you should use for COVID-19 vaccination reporting. So that was it for this module. Let me just quickly summarize a few of the key points. The first key point is that after each individual vaccination, you should take some time to fill out the vaccination record, so the home-based record, or issue a new vaccination card if the person came for a first dose. You should also fill out the tally sheet in the right classification and the facility-based immunization register. Then at the end or by the deadline of every reporting period, you should also send a summary report of the vaccinations administered to the public health authority in your district. That is very important to measure COVID-19 vaccine uptake and coverage, manage vaccine safety and effectiveness evaluations. So that was it for this module. So thank you very much for attending and good luck with COVID-19 vaccine implementation.